this video, I'm going to show you 2 critical treatments that you can use to calm down your knee pain if you think that you're having a failed knee replacement, you're having that chronic knee pain. Many people begin to suspect that they've got a failed knee replacement if it's been months or years since they finished their rehabilitation after having had a knee replacement. They especially believe this if the knee pain is just getting worse and worse as time goes on. The reality is that you can calm down your knee pain very likely and begin to work on the root problem that's likely causing your knee pain. I'll tell you more about that in the second half of this video, but let's get right into it. The first thing that you need to do to begin to calm down your knee pain is to offload your knee. Now, what I mean by this is to take pressure off your knee joint. The easiest thing to do is just to rest, to sit down, get off your feet, take pressure off the knee joint. But the second best thing you can do, because in reality you need to get around, you need to go to the bathroom, you need to go feed yourself and take care of responsibilities that you have in your life. So you need to be able to walk around. You need to get that walker out or that cane. Remember that walker that you probably had right after your surgery, or maybe you progressed to using a cane? If you're not using them, get them back out again. And if you are using them, if you've been using a cane, go find that walker. And if you're still using the walker, that's okay. You've got to think about putting more pressure than you have been onto the walker and off your painful knee. Giving your knee a chance to recover, a chance to not have to bear the normal loads that you've been putting through it, should allow the tendons, the ligaments, the muscles, the bursa, all the other soft tissues, the tissues that have not been replaced inside your knee joint to calm down so they're not swelling so much and causing you pain. Most of the time when people have chronic pain after having had a knee replacement, and it's been a long time and the chances of infection are pretty much gone, then it's because they're overloading the tissues around their knee and taking that pressure off by just leaning onto the walker more or leaning onto the cane more. That's what allows them to calm down. If you can think of it this way, if you can take 50% of the normal pressures that you've been putting on your knee replacement off the knee, if you can cut the pressures down in half, in other words, and sustain that for several days, maybe even a week, you should be able to feel tremendously better in your knee. Your swelling should go down, pain should go down, stiffness is likely to go down too, sleeping at night should improve, and you may need to do that for as long as you need so that you can get the pain under control. There isn't really a set time, like I can't tell you, yeah, just do this for 7 days, you're gonna be golden. It depends on how bad you're flared up, how much pressure you need to take off. There's a bunch of variables involved here, but the idea that I need to communicate to you in this video is that you need to take pressures off. If 50% doesn't work, try 60, 70, 80% or more. It may be that you're fine just taking off 10 or 20%, and that's enough to get the pain under control to a manageable level, and you feel like you're improving day to day. Either way, just make sure to reduce the pressures going through your knees and get on some device like these here. The second critical treatment is getting your glutes to activate. Most people don't have conscious control over their glutes, their butt muscles, and so this is causing them to overuse other muscles, usually the muscles on the front of the thigh that connect to the kneecap. Now take a moment and just wherever you're at, if you're standing or sitting, however you are, don't move positions, think about clenching or tightening up your glute muscles, your butt muscles. Just squeeze them as hard as you can. If you had trouble, if you couldn't just automatically get them to turn on and tighten up, then chances are you're not using them when you're walking, when you're getting up and down from chairs, getting in and out of vehicles. You're not using your glutes properly, and that's causing you to use other muscles. You're compensating, and that's what's leading to your knee problem. So a fix that you need to go through right now is just simply starting to practice clenching those glute muscles. Tighten them up and hold it for 10 seconds. You could do it in standing, you could do it in sitting, you could do it lying down. It doesn't matter the position that you're in. The only thing that you need to try to do is tighten the glute muscles without also tightening up all the other muscles in your legs. The first muscle that likes to compensate, you'll find out, is the thigh muscles right here on the front of the thigh. When you go to tighten up these muscles, you don't want to be activating the quad muscles on the front of the thigh. You need to tighten up this one back here and try to keep this relaxed. It may not be perfect, you may still want to fire this muscle up, but if you can tighten up the glute muscle back here and truthfully say, it's about 90% of the work back here, maybe 80%, and this is firing 10 to 20%, then that's good. That's where you want to be. But if you're tightening up the glute back here and the quad kicks in just as hard, 50%, it's 50-50 on both sides, or more, the quad kicks in 60, 70, 80% or more, then that is not good. You're using these muscles too much and it's causing you problems down here at your knee. This is the main reason that people have chronic knee pain after having had a knee replacement. And this is the reason that sets up people to feel like they're having a failed knee replacement experience. It's at the muscle imbalance where the quads are working too hard when the glutes should be working more. This is causing excessive pressures and pain at the knee joint. In most cases, this is the underlying root problem that nobody's been able to find. Your surgeon is not trained in finding these root problems. Their job is to do the surgery. And the physical therapist you probably worked with after you had the surgery, their training is to rehabilitate you to get you back to walking, to bending, not to fix the root problem. Now it's time for you to begin to address that, and step one for you today is going to be to get those glutes to activate while taking pressure off the joint and doing that offloading. Now, getting stronger glutes over the long term, getting them to activate on command and activate better and stronger is the key to offloading your knees for the long term to keep them healthy and pain-free. I've got a program that dives deep into helping people with a failed knee replacement. It's called the Failed Knee Replacement Recovery Program. You can find a link to learn more about it in the description below. I've also got a playlist of all our videos that help people after having had a knee replacement. You'll find that link in the description down below. Hey, if you thought this video was helpful for you, please share it and give us a thumbs up. And don't forget to subscribe and turn on our notification bell so you don't miss out on any of the helpful videos that we post each and every week. I'll see you in the next video. Bye-bye.